Hi everyone. A dentist was asking me a question that they provided a HICAPS or health fund quotation for a patient. And then when the patient did the treatment and they went to payment, the health fund actually rebated them less than what was quoted. And now they don't want to pay the difference and they feel like it's a practice responsibility. And they just simply don't want to pay the difference and just disappearing and they're not sure what to do with that. And I have a very strong opinion on HICAPS quote, and I want to explain to you what are health fund quotations or HICAPS quotation, because if you're not in Australia, you might have something different as well. And you probably want to, I'm not sure if you can apply this to your country or not, but you can get the idea of what I'm trying to say. First, for credibility, my name is Khaled. I have been a dentist for 20 years. I run my own dental practice, Lakeside Dental Spa in Harvey Bay, in Queensland, and I took it from 1 chair to 10 chairs, from 3 staff members to close to 40 staff members over the course of 15 years. And you can check my details below for credibility. So in Australia, some patients might be registered or have a health fund or private health insurance, and they pay extra cover to get some dental treatment covered as well. So for example, there might be an agreement with a certain health fund company that if a private practice is charging, let's say $2,000 for a crown, this health fund might give the patient $1,000, then the patient would pay out of pocket another $1,000. Most dental practices are not in agreement with the health fund, but usually they have an agreement where they have a machine, and this machine allow the patient to swipe their private insurance card so that the $1,000 can go straight from the health fund or the private health insurance straight to the clinic, and then the patient is pay the difference. Sometimes dentists, to make the treatment plan more attractive, or let's say they have a patient with a broken tooth, they might provide the patient with something called a health fund quotation or a HICAPS, this is the machine, quotation. So they tell the patient, okay, give me your health fund card, let's put in the machine. Well, your private insurance say that they will pay around $1,000 for your crown, so your out of pocket will only be $1,000. How does that sound for you? Great, let's do the crown. The problem with that is you might do that and then the patient finishes the crown work, you put a CEREC on whatever, patient calls out and then they start payment, then they swipe their card now because it's not a quotation, it's actual billing. The health fund decide, oh, you know what, we're going to give you $800. Could be an internal error or something that wasn't done properly, or many reasons that sometimes outside the control of the dentist. And that's when the patient might not be happy. So how can you avoid that? I'll tell you what I did. And again, I'm being very unfiltered, being genuine with you. I'll tell you exactly what I did in my own practice, in my own career as well as a dentist. I tend to separate myself from the health funds as much as I can. So patients, the problem when you start talking about private health insurance, you're limiting yourself a little bit. So let's say, for example, patient needs full smile makeover. So let's say 10 veneers or 10 crowns. And to make it look nice and beautiful, you want to do it all at once. If you try to do 1 crown every year, 2 crowns every year, it's hard to match the color and the shape. If you start training your patient to think about their health fund limit, and some health fund might give them a limit of 1 crown or 2 crowns per year, so anything more they're not going to pay them, then this patient will be used to that and they only want to do 1 crown every year to maximize their benefit. Yes, they maximize their financial benefit, but they minimize their clinical benefit and their clinical aesthetic outcome. But the best care is to get them a little bit away from that and talk about how can they get the most amazing, beautiful, functional smile in the most efficient way rather than waiting and doing 1 crown every year. So usually I separate myself a little bit from the health fund as much as I can. Secondary, I don't provide health fund quotation. Some patients ask for it. If they insist, if I am going to do this quotation, I will have a clear disclaimer or a consent. I am not responsible for this quotation. This could be just an estimate. We cannot control what the health fund will pay you. This just advise you. This could be a possible payment from the health fund. If you want an accurate quotation, later on, you can take the stream plan to your health fund and call them yourself and get a proper quotation. But here's our full fees, and we cannot control how much the health fund will pay you back. So if you still want to give a quotation, make sure you separate your responsibility from that. Have a disclaimer or consent saying that you're not responsible for this quotation. This is just an average rough estimate, and we cannot control what the health fund will pay you. If you do that, and the quotation, as when it comes to billing, doesn't match the quotation, then you're not responsible. Very, very important. So to summarize, I'll separate myself from the health funds because I don't want to be limited by what I'm providing to my patients by putting limits of what they can get done every year. Secondary, if you get stuck and you have to provide a quotation, have a disclaimer saying that it's just a quotation and it's controlled by the third-party health fund and you have no control over if it's going to be actual or not. And for more accurate information, you need to ring the health fund. If it's an emergency situation, you can always temporize and book them in a different time. Or you can make it clear they can pay in full and they can chase payments for the health funds. So if you do that routinely, you won't have those problems as often. And if the situation where you also kind of like, you're establishing a relationship with the patient where if this private health fund open a practice in your area and they try to take all their patients to the practice by luring them and give them higher rebates, they might still stick by you because they know that you're trying to provide them the best care, regardless of what they can get from their health fund. So it might build a little bit more loyalty with your patients. So you have less problems, you have more loyalty. So if you find this information helpful, make sure you like it and share it with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel and you'll be notified when more videos are released. Thank you so much for listening to me. It means a lot to me.